Well, first of all, once you get a vaccine, it would take some time before you start producing antibodies. So, generally, after the first dose, it takes about 21 days or so before you start producing antibodies and that it gets to that peak where it's going to be protective. After the first dose, for most vaccines, you would see a difference in your antibody level that is going to protect you. The reason why you're doing a second dose is you want to boost that to an even higher level, and that's why we do the second dose. So, in the period when you're still vulnerable, I would say, after you get the first injection to that 21 days, you can still get infected. Because remember, we are saying that none of these vaccines would prevent 100% of infection. So there's a little possibility that you can get infected. But if you get infected after 21 days, then your chances of getting a serious form of the infection is drastically reduced because your body now has antibodies that can fight off this virus. If you get infected after 21 days after the first dose, you wouldn't get that severe form of the disease. You more than likely would not end up in the hospital or in the ICU, and it would certainly prevent you from dying from COVID. You might die from something else, but not COVID, because these vaccines are protective against death from COVID. You're considered fully vaccinated after about 7 days after the second dose, and are fully immunized, because 7 days after the second dose, your body would have been able to react appropriately to make, you'll see a boosting of your antibodies after 7 days. So generally it's considered 7 days after the second dose that you're fully immunized.